So there are limits to get these eyebrows up to a certain extent.
Depending on the individual?
Depending on the individual and depending on the doctor as well, and the race as well.
Okay.
Because there are different, there are many differences among different races.
Really?
Yeah.
So tell us maybe a little bit more about this, Dr. Mohammed. It sounds interesting.
Probably it's very clear among you, like among you two, like the difference between Diana being a bit dark skin and you a bit like light skin. So there are differences related to the skin color.
The pigmentation?
Yeah, like probably Diana more likely to age slower compared to...
God, thank God. So this is true. I heard about this.
Like if you look at the lady who should look dark skin and it's 50s or 60s, it's hard, you can see like wrinkles around her eyes or in her face.
I've heard this before.
White people
so you mean
in Europe.
like for example, like Latinos or Africans, people with dark skin usually. Thank God, thank God,
and
thank God.
Because like they are rich with melanin, and the other thing, if you see like in Africa, or kind of compare it with Australia, the incidence of skin cancer, for example. You hardly hear there's something reports about skin cancer in Africa, but in Australia, it's very common and it's really more like melanoma or something.
Is it due? I believe it's not just due to the skin coloring and the pigmentation of the skin, but I believe it's also due to lifestyle. I mean, people in Africa have a different lifestyle. They eat, let's say, more vegetables and fruit. I know that sometimes it's due to the lack of availability of purchasing meat. If, let's say, in countries where there's high levels of starvation or whatever, but it's a different lifestyle. I think in Australia they're a meat-eating society. I think there's a number of factors that contribute to it.
Yeah, but I would disagree on a point like probably there is no vegetarian people in Africa. You would find like vegetarian people in Australia, and probably there are more sun in Africa compared with Australia. So there is not something related to actually to how people are made of. So people who are white, they have a skin color which is called type 1, like according to the amount of melanin which is present in the skin. We divide skin in six different types. Okay. So white being type 1 and black being type 6.
Wow.
We, like probably in the Middle Eastern part of the world, we are between 4 and 5.
Okay. So we're still close to number 6.
Yeah, closer, more than that.
Lucky. Dr. Mohammed, let's talk a little bit about the patients. Who are the patients that actually come to the clinic or come to the surgery and request these kind of procedures? Because me and Diana were talking earlier about the increasing interest in men in self-grooming, and also nowadays in cosmetic surgery. More and more men are also trying to look attractive and also trying to look young. Do you get any men? Is this something that we are starting to see in the Middle East or the Arab world?
Actually, yes, but I would like to point a thing that I explained to Diana earlier in an earlier interview. There's nothing called cosmetic surgery. It's called aesthetic. Like it's being based on like an Anglo-Saxon term, like cosmetic. Like cosmetic is the thing you buy it in the pharmacy to beautify you. So there's nothing called cosmetic surgeon. It's like an aesthetic. So, but people's like in the media being influenced by the Anglo-Saxons, so they are saying it's cosmetics. There are like it's common. There are some procedures which are common among men, but not the lifting with thread. It's mainly like they will undergo like liposuction, abdominoplasty, rhinoplasty. Stuff like that, more or less like something they have a defect, or they need some kind of reconstruction being done on them. They don't go mainly for purely aesthetic reason compared with females. There are some who would do that. Probably the ratio would be like 3 to 10, or you're gonna compare it like females and males.
That's interesting. So what about the candidates? For example, who's a good candidate to perform this new procedure, facelifting with threads? I mean, depending on their age, depending on their health, for example.
People are between the ages of 30 up to 60.
So 30 up to 60, okay.
People who are not willing to undergo surgery.
Okay.
People who would like to have like a short-term result, and then they're gonna reassess afterwards. Because like usually surgery have a long-term result, so it's very difficult to have a redo surgery, because like it's costly. It takes time. People have they be bothered being and subjected to surgery. But this is a procedure, you can do it in the clinic. It lasts like 30 up to 1 hour max, and people can be discharged home like right away.
What about the after effects? Or I mean, I know sometimes there would be swellings or redness involved, but let's say by some surgical procedures that are done. But what about this procedure, for example?
If it's done properly, usually there's because like it's usually in the subcutaneous tissues. You know where are you going. You're avoiding major vessels or major nerves.
Okay.
So you are going around. So mainly there's nothing. But we'll be very clear on the videos. I would like to see the videos.
I hope. I'm not sure if our video is. Hopefully it's ready, but we'll be seeing hopefully, let's say, some graphics of how this procedure is done or in what ways it is done. But hopefully until it is ready, I really believe you guys, before you think of having such procedure, please consult your doctor or your consultant, for example, to give an idea more about what you're looking for, and hopefully your doctor can give you an idea what is the best procedure for you.
Absolutely, absolutely, Diana. And of course, Dr. Mohammed, something that comes to mind is, because you mentioned us as a Middle Eastern society or here in the Arab world, does culture and, let's say, where we are in the world play a role when it comes to opting for certain procedures? Like, you mentioned that men don't really go for facelifting procedures so much here in the Arab world because maybe culturally or as society explains, the age is not so much of a concern for men. A man can still, let's say, live his best days even if he's old, as long as he has other supporting factors. But in the West, things are slightly different. I believe that more men are interested in the procedure. I mean, what do we tend to go for as a society relating to how we see beauty here in the Arab world?
I believe everything, you are quite right, because everything depends on like how civilized the society is. You know? People in the Arabic world in general, they lack the information. So if you're gonna take a look like at people in the Western societies, they have like in-depth knowledge of beauty or what things to be done. Like beauty is actually, it's a relative term, and if you're gonna define it, it's like an illusion. And there is an English saying that like beauty is in the eyes of the beholder.
Absolutely.
Which is like, I can see something beautiful, probably you would disagree with me.
Absolutely.
Exactly.
You know? So people in the Arabic world, especially men, they don't look at things as people in the Western society.
Absolutely.
You know, so it's like they have different values, different ways of thinking. So they don't share the same point of view as people from the Western society.
So based on this, I mean, based on what you said, which is very true, that every region or every culture and every society has a different way of thinking and sees beauty from a different perspective. What do we as an Arab society opt for in terms of plastic surgery based on our traditions, our beliefs, and how we see beauty? Let's say what's more common.
Yeah, probably they would opt to rhinoplasty. And whether it's surgical or medical, right now we are able to modify noses by using fillers and botox, which is like it's easier.
Okay. That's temporary though.
Yeah, that's temporary though. But people, as like facial lifting with threads, so we will give you like the opportunity to reassess.
Okay.
You know, sometimes you take a decision to undergo surgery, but later on you would say, oh, probably it wasn't really a good decision to go.
But it won't make the nose smaller, right? This is an interesting issue because if somebody's not happy,
to be operated on. You cannot do it.
Somebody's not happy with size, then we need.
Yeah, probably if you're gonna fill something or gonna modify the rotation or the direction of how the tip looks like. Like we have the term projection or rotation. So you can do this with botox. But if you go like to decrease the size, you need like surgery. You cannot do it with any procedure apart from surgery. This is being said on rhinoplasty, but they would opt for breast reduction, breast augmentation, abdominoplasty. Body contouring procedure after weight loss, like brachioplasty, thigh lifting, liposuction in general.
That's interesting. And so, very importantly, we should have talked about this earlier, but complications, let's say, are there any complications that arise with the facelifting with threads? Or what are some of the common problems that people face later on?
It's usually, probably in the early days, probably would be some redness.
Redness, okay.
Yeah, some redness. People would feel sometimes weird sensation underneath the skin. But that would fade away within a week, up to 10 days max.
Okay, all right.
So it's nothing like which is long-lasting or something like that.
But it's not visible in any ways,
No,
is it?
no.
Okay, that's good.
It's not like in the skin. So you're going deeper.
Okay.
You're going deeper. You're going to subcutaneous tissue.
All right.
So there's no way being visible to the other people.
Dr. Mohammed, just before we go, since we're running out of time, I believe we have some technical issues with the videos that we were hoping to show the viewers, unfortunately. But just before we go, a couple of tips to anybody watching us at home who would like to opt for any method of change, not just necessarily facelifting, but any method of change from your perspective.
I believe the most important thing is to have a realistic expectation, being reasonable.
Can the doctor help you with that,
Yeah,
for
sure.
example? Okay, so
Like if the patient he has to do his homework, being searching around, looking around what's right to be done for her or for him.
True.
And the thing is to be realistic with the result.
Okay, that's good. That's really good. So you guys have to be realistic, and if you have, I know many of us would have an idea of how we want to look like, but consult with your doctors so that they can tell you exactly what is the best method for you, or let's see what's the best message for the procedure that you're going to for.
Absolutely. Of course, on this note, Dr. Mohammed, we would like to thank you so much for joining us and for clearing up so many differences that we had, or that the viewers also have, when it comes to facelifting and other methods of constructive surgery.
You're welcome.
Thank you
It's been
so
a
much.
pleasure.
Of course, joining us in the studio was Dr. Mohammed Alnasir, who's a plastic surgery consultant. It's time for us to move on, though.